Hi, my name is Laura Dupre, and today's topic is Clostridium tetani. So I'm just going to read this case study through. So a patient arrives at the hospital with tightness of the jaw, muscle spasms, headache, and fever. They also have a puncture wound in their foot that is red and swollen. The patient provides their medical history and states that they haven't had a tetanus shot for 15 years. After the gram, acid fast, and endospore stains are performed, the results below are seen. All right, so some stains that, so for the gram positive, it's positive because the primary stain stuck, which is crystal violet. For acid fast negative, it's negative because it stuck to methylene blue. And for the spore positive, it's positive because you can see the green spores. Spores can only be seen through malachite green. All right, so some facts from the case study. The morphology of this bacteria is long rods. I think this picture really depicts well how the rods look. It's treated with penicillin, which is an antibiotic. The portal of entry is parenteral. So example for a nursing, if you were to get a shot for your flu shot, it would be right here in your muscle. That is called a parenteral portal of entry. This cannot be passed to someone else. So if I put my hand on someone's shoulder that has it, I will not get it. Ways to prevent this is to be aware of your surroundings, wear shoes if you're outside, watch out for what you're going to step on, be cautious, especially in somewhere you've never been. You want to be proactive and you want to get that shot for tetanus every 10 years. So an example of a vaccine that contains tetanus would be Tdap. So the importance of spores. Spores are protective structure. This bacteria is hard to kill off with antibiotics because the spores are protecting the bacteria. Spores form because of harsh conditions, extreme temperatures, and because bacteria is stressed. Spores are metabolically inactive, so they're dormant, making it harder for them to be killed off. So in this picture, you can see the spores are green/blue. The vegetative cells are the red cells, which are long rods. So for Clostridium tetani, most cases are in developing countries where immunity is lacking. So that would include like water that's not drinkable, stuff like that, where you can't rinse your hands as well. I also didn't know that Clostridium tetani also shows up in areas that have experienced natural disasters. I really thought that was cool. I really didn't think about it in that way because it mixes up the soil and the spores show up. So newborns are also at risk, like everyone else, if their umbilical cord is cut with non-sterile equipment. For newborns, it's very serious because they're very young, obviously. So that's really fatal in newborns, so definitely be careful. So some interesting facts. Their natural habitat is soil, dust, sometimes manure. So this causes, Clostridium tetani causes tetanus. Some people think that stepping on a nail causes tetanus, but in reality, it's the soil on that nail or whatever you step on that transfers the pathogen. Deep wounds are more at risk than abrasions or cuts. And this happens because deep wounds are also deeper in the muscle and where there's less oxygen. This bacterium only grows and makes toxins in low oxygen conditions. This also causes irreversible damage to neurons. I did not know that. So for tetanus, it causes toxemia, which is blood poisoning. This toxin for tetanus is also called tetanospasmin. So what it does is it blocks neurotransmitters and it causes locked jaw. So if you're in the medical field and you have a patient that has this, they're not going to be able to tell you what's happening, and they're not going to be able to cry out in pain. So pretty much what it does, it prevents muscle tissue from relaxing, and that is called spasmic paralysis. So according to the CDC, there's an average of only 30 cases per year in the US. I really thought it was more common until I looked further into this. And it's due to the fact that we have a vaccination. Some symptoms include locked jaw, involuntary muscle tightening, which is common in the stomach, painful muscle stiffness all over the body, trouble swallowing, jerking or staring, which is seizures, fever and sweating, and changes in vitals, which would include the heart rate and blood pressure. So less common causes are bug bites, animal bites, dental work, chronic sores, which could be diabetic sores, pressure ulcers, infection. Incubation period is approximately 8 days, but it ranges 3 to 21 days. Pretty much what an incubation period is, that is the time between you get infected and when you start showing symptoms. So for some complications with tetanus, it causes uncontrolled and involuntary tightening of the vocal cords, which is also called the laryngeal spasm. Broken bones, hospital-acquired infections, pulmonary embolism, pneumonia, difficulty breathing, which could possibly lead to death. A lot of these, the hospital-acquired infection, PE, those can lead to death as well. They're very serious. You really don't want to have complications with this. According to the CDC, 1 to 2 in 10 cases are fatal. That's some scary stats. So what you're going to do, you really want to get treatment ASAP. It can be deadly if not treated promptly. Even if you get a simple cut from falling, you're going to want to treat that anyway, and you want to make sure that you have clean hands. Clean hands are very important to prevent this as well. And some sources I used was the Pearson textbook, cdc.gov, and healthline.com. Thank you guys for watching.